Good afternoon, guys. My name is Dr. Alex Fernandez from Life Chiropractic and Acupuncture, and today we're going to talk about shoulder injuries. The shoulder is a very complex joint, and we treat shoulder injuries here in this office very frequently. I'm going to start out with some anatomy so we get an idea what we're dealing with. These are the nerves that come out from the neck that feed the shoulder. So plenty of nerves in this area. You have muscles here, you got your biceps, you got the tendon connections in there, and then you have the ligaments that are connecting the bone to the bone. So why do shoulders get injured so much? The shoulder has a lot of range of motion, which means we can move it. There's a lot of flexibility. We can move it up, we can move it down, we can move it towards the back, inside, we can rotate it this way, we can rotate it this way. So there's a lot of motion, and at the same time, it's a very good thing, but there's also a lot of chances for getting hurt. And one of the common things that we see here is people getting hurt from the gym. We also see people getting hurt from either throwing a baseball, anything that requires a lot of motion and a lot of hyperextension. So that's where a lot of people get injured. Also during weightlifting. So one of the things, I'm going to give you a real life example. I have a patient recently that came in, they were bench pressing, and as they were bench pressing, during the last couple of repetitions, they started to get fatigued, and the arm just started to drift down, and in order to avoid the weight hitting him, obviously, he pushed really hard with the left hand side to bring the weight up, and he injured the tendons and the muscles in this area. So what we do here is we locate exactly what is it that's wrong with your shoulder. If it's a tendon, if it's a muscle, if it's the fascia around the whole area. We use also laser therapy in order to correct these issues. So the first thing to do is to do a proper evaluation of the shoulder. I check your ranges of motion, I check your strength, I check to see what is it that's deficient and dysfunctional in your shoulder. Once we do that, then we go ahead and we attack the problem. So if you're experiencing some sort of shoulder injury, please call my office and let me see if I can help you with your kind of shoulder injury. Thank you.